Thank you for joining the Gold Coast Health Service District Infection Control Team today for this short presentation on the new 2011 isolation stop sign, which will be phased in across all campuses between the 15th of August through to the 12th of September 2011. We have developed this presentation for all Gold Coast Health staff involved in the direct delivery of care and services to inpatients who may be isolated. Specifically today, we'd like to achieve the following objectives. Firstly, we will be discussing the need and opportunities to improve the current method of isolation signage used across the district. Secondly, we are aiming to introduce management and staff to the proposed new isolation sign, including its supply, recommended local placement and use. And finally, we will be providing detail about specific dates when and locations where the new isolation sign will be introduced. As we provide those pieces of information, we hope that we have anticipated and provided useful answers to questions that staff may have during the introduction and implementation of this new sign. Isolating a patient in a single room or having them share a bay with other patients with the same disease or organism is one of the most effective ways of preventing the spread of infectious disease from patient to patient and from patient to healthcare workers and visitors. Isolating a patient is part of a suite of infection control measures that include hand hygiene, cleaning, and early identification of patients that pose a risk. On any given day across the district, the infection control team identifies that between 2 to 10% of inpatients require special placement in either a single room or a bay. Within the Gold Coast Health Service District, for more than a decade, we've been using the current stop sign as a means to identify that a patient or patients in the corresponding room or bay are in isolation. When used properly, the intent of the sign is to warn staff that before entering the room or bay, they should stop and familiarise themselves with the necessary personal protective equipment, PPE, that is required to provide them with protection from the patient's disease or organism. For clinical staff, such as doctors and nurses, they would likely know the nature of the individual disease or organism, and they should use their clinical skills and knowledge to undertake a risk assessment before selecting and applying the appropriate PPE. For other non-clinical staff, including administrative, catering, and environmental services personnel, they do not have the skills and knowledge to make the proper risk assessment and corresponding PPE selection. It is not appropriate for these staff to know the nature of the patient's condition or organism, and doing so potentially breaches the patient's right to privacy. However, all persons who have a legitimate reason to enter the room or bay of an isolated patient also have a legitimate right to be protected by being able to identify, access, and apply the necessary appropriate PPE. Currently across the district, we understand that there is wide variation in compliance with recommended PPE use. We also understand that some clinicians, and especially non-clinicians, do not have the necessary skills, training, or knowledge to make the correct choice of PPE. Regardless, our core business is to protect staff and patients, and so we have designed the new 2011 stop sign so it provides a clear, easy to understand indication of the individual PPE and other measures such as the method of cleaning required to eliminate the risk of transmission of infectious disease throughout our facilities. If we look here at the new 2011 stop sign, you will notice major differences compared to the previous stop sign. Let's now look at the sign in detail. Firstly, note that it very clearly stipulates you need to wear these items when entering this room. This is a serious warning and emphasises the importance of staff wearing appropriate PPE to avoid potential exposure to infection. Next, note that there are 4 specific areas that include pictures and text to help staff identify and select the necessary recommended individual pieces of PPE. 1. The mask. 2. Gloves. 3. Apron or gown. And 4. Eyewear. The remaining 2 sections provide specific advice about hand hygiene and cleaning of reusable equipment. Many of you, and especially doctors and nurses, will understand that different infectious diseases spread or are transmitted via specific routes. There are 4 main routes of transmission: droplet, contact, airborne, and combination of airborne contact. The type of isolation, specific items of PPE, and recommendations regarding cleaning and hand hygiene vary according to disease and transmission route. We do not expect anyone outside of the infection control, infectious diseases, or microbiology departments to retain the specific information about which diseases are spread by which route and which equipment and measures are needed according to each disease. We know it's hard stuff to remember. To make it easier for staff on the wards who will use the new 2011 stop sign, we've developed this isolation precautions guidance sheet. It's like a stop sign cheat sheet and should be used by the nurse who is advised to isolate a patient to initially tick the appropriate boxes on the new 2011 stop sign, and then for the nurse in charge of each shift to update the 2011 stop sign as further information and pathology results become available during the course of the patient's admission. This slide shows an example of what a ticked stop sign should look like outside the room of a patient with MRSA. By cross-referring to the isolation precautions guidance, you will note that MRSA falls under the category of diseases or conditions that are spread through direct contact. The ticks here have been added according to the recommendations for contact precautions. Note that the sign was last updated on the 3rd of August 2011. We recommend that staff use a dark, whiteboard type pen to tick the boxes on the stop sign. Ticks can then be easily rubbed off once they are no longer needed for the respective piece of PPE, or hand hygiene or cleaning recommendation. When this new sign is introduced to your division, the District Infection Control Team will provide you with enough copies of the sign for the numbers of patients typically isolated on your ward on any given day. This will vary by ward. As the signs are laminated and reusable, we anticipate that those initial signs should withstand normal day-to-day wear and tear for several months. In the event that there is an increase in the number of patients requiring isolation, such as in an outbreak or pandemic setting, ward staff can obtain additional laminated copies of the sign from the infection control officers at Southport and Robina hospitals. Currently, each ward has a place where they have been storing the soon-to-be phased-out stop signs. Staff are familiar with having to go to that place to find a stop sign, and so we recommend that you receive your starter kit of the new 2011 signs. You simply remove and dispose of all the old signs and restock with the new 2011 signs. Your sign starter kit will also contain one copy of the isolation precautions guides sheet, the cheat sheet, for every room bed on your ward. We anticipate that staff will need to access the isolation precautions guidance cheat sheet often and easily. We therefore recommend that a copy of the isolation precautions guidance cheat sheet is placed in every ward in each patient's folder. That is the folder that typically stays either at the foot of the bed or in the box outside of the room and holds the patient's observations and medication charts during their admission. In addition, each ward may have some central location where they keep critical information so that it is easily accessible and so that staff can find it fast. That may be a great location to place at least one additional copy of the isolation precautions guidance cheat sheet. Please note that the guidance sheet is not designed nor intended to be placed up outside any individual patient room or isolation bay. It is an internal document designed to be used by the nurse in charge for reference so that he or she can tick the posted new 2011 stop sign appropriately for individual patients on a case-by-case basis and according to recommendations provided by the Infection Control Department and/or as per the relevant District Infection Control Procedure documents, which can be accessed on QIPS. The most important thing is that the relevant staff on each ward always have access to the isolation precautions guidance cheat sheet. This slide includes the proposed dates that the 2011 sign will be rolled out across the district. On the Monday morning of that week, a member of the infection control team will visit your ward and provide you with your starter kit. In the interim, we are keen for staff to watch this presentation, and if they have any questions in relation to the introduction of the new sign, now or in the future, please contact the infection control team on either extension 8976 at Southport or extension 6386 at Robina. Your starter kit will also include a frequently asked questions sheet that we hope will address possible questions and concerns staff may have in relation to this project. As always, we thank you for your attention and of course your ongoing efforts in working with our team to keep our patients, staff and visitors free from infection. If you would like additional information or to provide feedback on the new isolation sign or other issues addressed in this presentation, please call us during business hours Monday to Friday.